righty, we'll go ahead and get this party started. This is going to be recorded, so make sure you do that, Jamin. And so as folks come on, if they need to get the recording, then we're happy to get that to them. So again, hey guys, Paula Workman White here for Oaks Medicare Planning. I'm glad y'all could join. And happy to have my husband and business partner, Jamin White, be our speaker today. I know we have kind of a mixed bag between folks that are turning 65 soon or transitioning to Medicare soon and their advisors. So I see quite a few advisors on here. Hi, guys. And so Jamin's going to kind of look at it from both perspectives. So if you're the one going on Medicare or your family member, and then also if you're an advisor, and kind of giving you a heads up on what's going on in the industry. So with that, I will introduce Jamin. So Jamin is my co-founder here of Four Oaks Medicare Planning. He has his law degree from the University of Texas Law School. However, we call him an ex-lawyer. He much prefers insurance to law. AHIP certified, licensed, and independent, and that's a really important word. That's why we highlight it there, to note that the independence means that we have a lot of different companies. So it's not just one company. We're not just a single insurer, but it's pretty much a wide range of choices. And then he also has some experience in corporate benefits and HR. And so he's really versed in actually transitioning folks from their employer plan over to Medicare when the need arises. So with that, I'm going to hand it over to Jamin. If everyone will go ahead and mute themselves, we will have time at the end to have questions. But if you could mute yourself during the presentation, that'd be great. And then we can open it up at the end and you can unmute yourself at that point. So that being said, I'm going to pass it on over to Jamin.
Great. Thank you, Paula. And it's a pleasure to be here this evening, this cold, very cold evening for everybody. So maybe this is a good time to visit about Medicare. So as she said, we're going to talk about the basics of Medicare, and I will save time at the end to answer any questions that you have. I mean, whether you're approaching 65 or you're helping, your clients as they're trying to begin to navigate what Medicare looks like for them, a lot of clients are going to look like this. You just don't know where to turn. And so what we try to do at Four Oaks is just make this a clear shot. Answer the questions, be a resource so that you're not starting and stopping and just find yourself in a big maze. So I'm hoping after this presentation today, it might not hit every single thing that you thought, so we can have a conversation about that. But hopefully it'll just help you with the basics and just really understanding and build a framework just to kind of know, what questions do arise often. So let's just begin real quick and just talk about the first part. It's called Original Medicare, Part A and Part B. So it's just really important to remember that Original Medicare is divided, and Part A is called your hospital benefit. It's inpatient. So if you spend the night in the hospital, you're going to activate A. Part B of Medicare is called medical, but really just think outpatient. When you're going in for a doctor visit, an MRI, even chemotherapy on an outpatient basis is going to fall under Part B. So both of those parts are very crucial when Medicare is your primary insurance. Now, it's also important to know that Original Medicare doesn't cover everything. And so, one of the things that's important to remember is it doesn't cover all costs. So you're not going to get 100% coverage. And it actually has the biggest kind of ugliest part of Medicare that I talk about, that we'll visit about, is there's no out-of-pocket limit actually under Original Medicare. So that's a very big problem that we have to address. Medicare doesn't cover prescription medications that you pick up at the pharmacy. That's going to fall under Part D, as in David. So routine dental, like eyeglass coverage, routine vision screenings, hearing aids, those are excluded from Medicare as well, Original Medicare. Always remember that a Medicare is not going to be a long-term care policy or provide custodial care services on a long-term basis. And also, it's very limited what Medicare will do outside of the United States when you're traveling. So just be aware of that too. So let's kind of talk about what Medicare, original Medicare looks like in terms of cost and coverage in 2025. So remember Part A, the inpatient benefit of original Medicare. For most people, it doesn't have a cost. As long as you've worked your 10 years or 40 quarters and paid into the system, generally Part A is premium free. But when you do access inpatient care under Part A, you will have a deductible. That deductible this year is $1,676. But one thing I want to point out is just look at where it says per benefit period. So it's not going to be an annual deductible. So that's something you just want to remember is you can hit that deductible more than one time per calendar year. It's just depending upon the length of time between a hospital stay. And then after the 60 days, notice that there's other per day costs and they can get pretty high. And then remember, there is no out-of-pocket limit. And again, we'll hit on that on this next slide. So let's talk about Part B costs. Part B, remember, is the outpatient benefit under Medicare. And it does have a premium. For most people, it is $185 a month. The government will set that every single year. Usually around the end of the year, it comes out with an updated per month cost. So remember, it says for most people. So remember, your income can cause you to pay more than the base price here. So, and we'll look at a chart in just a second for that. But as far as coverage wise, there is an annual calendar year deductible under Part B. It's $257. So it's quite low. And then generally, you're going to pay 20% of most covered services. The government's going to pay 80% under Part B. And now you see again on the right side, again, no out-of-pocket limit. And so I'll just stop here and just stress, this is very different than what you might have had under any commercial insurance plan that you've had through work, or even if you're on the marketplace. Most of the time, there's an out-of-pocket max. And then after that, if your costs for that part of the year hit that max, you're covered at 100% after that. Original Medicare does not work that way. So just remember that 20% under Part B is unlimited. Your bill could be 20% of $500 approved cost or $500,000. There's nothing that's going to cap it. And so that's really important to remember. Excess charges is just something that you would be responsible for if you went to a doctor that accepts Medicare, but not as full payment. Those excess charges are capped under Part B at 15% of what Medicare approves. If you go to a doctor like that, you would be responsible for that extra cost as well. So I remember I mentioned that based on your income, you can actually pay more. So this is, for planning purposes, if you happen to be in your early 60s and you're kind of wondering how your income might play out with Medicare, it's really important to pay attention to this slide because in 2025, what I want you to remember, this chart is based on 2025, but if you look right below where it says Part B and D premiums by income, see where it says based on your filing status and yearly income in 2023. So there's a 2-year look back when they consider what your Part B premium is going to be, and also Part D will get there as well. But you'll notice just on the left-hand side, whether you're an individual or joint filer, you'll notice there's different income brackets. And then on the right-hand side, it'll tell you what your premium would be based upon where you fall within 2023 for a 2025 enrollment for Part B. So you'll notice that, it can definitely be pretty significant. It does cap out at the very top at 500,000 or 750 based upon your income status, but just be aware that's something you don't want to be surprised about, and it could affect decision making on what to do with your job-based insurance or what to do with investments and how you're going to do your retirement because your modified adjusted gross income is what they're going to look at to determine your IRMA, or basically your income surcharge. So just be aware of that. If you have other questions, we can talk about that, but you just don't want to be surprised when you're going on to Medicare on what your premium would be and why. So I always like to give some important reminders. You know, you're going to get a lot of different questions, or if you're approaching 65, you get a ton of stuff in the mail that looks very governmental. A lot of times those are marketing pieces, and they're warning you like you got to go on to Medicare. You're gonna have a lifetime penalty. In some cases, that can be true, but it's going to be based on your particular circumstance. And so I want to kind of go through some of the gotchas under Medicare that I find will help relieve some people, and also just make sure that you're very aware of what some of those gotchas are. So for example, Part B is the biggest one. You know, Part B late fees, it can be pretty brutal. If you don't go on to Medicare when you're supposed to, it's a 10% penalty per 12 months that you're not on Part B without some sort of credible coverage or what's called other qualified other coverage. And so it is a lifetime penalty. So something you want to avoid. And the way you're going to avoid it is just to make sure that if you don't go on to Medicare, you fall under that qualified other coverage bucket. And pretty much one of the probably 95% of the questions on, well, what is qualified other coverage? It's going to be employer health insurance. And so let's talk about, what do you do with Medicare when you have an employer plan? And so this is really important because it depends upon actually your company size. So the rules are that if your company is 20 or more employees, Medicare is actually designed as secondary insurance to your employer plan, which will remain primary. Now, if you're less than 20 employees, Medicare is actually designed to be primary to that employer plan. So the rules are very different. So in the case of a large group employer, which is 20 or more employees, many people will delay Medicare. Because Medicare, if you go on it, is going to act as a secondary insurance. But if you are with a small group employer, less than 20, it's advised that you do go ahead and go on to original Medicare to avoid any gaps in coverage. That's really important to remember. Now, some people wonder, well, what about A? It's premium free, and maybe I want to do A and not B. Well, if you're with a large group employer, remember Medicare being secondary, many people would go on to Part A of Medicare and delay B because you have a secondary coverage for some hospital, but it's not costing you anything. So a lot of times that is something that people will elect to do. You get your Medicare number and you delay B for the future when Medicare is going to go primary for you. Now, there is a circumstance where you would not want to do either Part B or Part A if you had large group employer insurance. It would be if you want to continue to contribute to a health savings account. So that's one of those gotchas that I brought up earlier. HSAs are not good for Medicare. Mainly, you are disqualified from actually contributing money into an HSA if you have Part A and or Part B. So just be aware that if you like the HSA and you want to continue to contribute to it for the foreseeable future, don't go on to either Part A or Part B. The other thing to remember too, just for planning purposes, so as another kind of gotcha, is Part A, if you maybe work a couple of years after you turn 65, and then you decide to go on to Medicare, Part A is going to go retroactive back 6 months. So it's always advisable to stop those HSA contributions 6 months prior to when you're going to go on to A, so that you don't get caught having put in contributions that are no longer eligible because of the retroactivity. Just remember, veterans coverage is not credible to Part B of Medicare. Same thing with COBRA. Veterans VA comes up occasionally, but COBRA is one that can catch people, and it can cause you to be subject to late penalties because COBRA insurance is not considered active employee coverage. So while you might think COBRA sounds great and I'll just keep the same plan and ride that out for 18 months, it's not going to work that way. You do not get any extra time to enroll in Part A and Part B based on loss of employer coverage based on having COBRA. So just remember, you're going to sleep and forget a lot of this. And so part of what I want you to remember is there's some just trigger words that should alert you, when it comes to Medicare. And employer insurance, HSAs, Cobra, that's going to be where that's going to come into play. Just a reminder, if anybody that's not muted, go ahead and mute. Looks like we have a little bit of feedback coming in. So let's just talk about what you do once you have A and B. So remember, A and B doesn't cover everything. So we talked about the unlimited liability because of the no out-of-pocket maximum and just some of the other things like the prescription medications. So what do people do? And this is where it can get really confusing because the government recognizes that Medicare A and B have some issues. And so all of the insurance companies, as you're getting toward Medicare eligibility, are going to start inundating you with all of their fancy brochures. And it's really makes things very, very confusing for someone who's approaching Medicare and what to do. And so just forget all of the insurance companies, because what really makes it easy for, this webinar today is there's really two options that someone will choose when going on to Medicare to address the limitations under original Medicare. And so let's talk about each of them. So let's first talk about the Medigap plan. So the Medigap plan is actually an option that you've probably never had access to before. It is quite unique and it's very, very popular, and there's reasons for it. So with a Medigap plan, essentially you stay on original Medicare. So what that means is you're not under the umbrella of an insurance company with networks. Everything flows through Medicare as far as claims. And then the Medigap plan, what it's designed to do, and all it does, is really pay claims. Those things that you would be responsible for under Medicare Part A and Part B, the Medigap plan is designed to essentially pay most all of those claims for you. So let's talk about what this looks like and how it works. So this can be a very intimidating chart. So I'm just going to break it down in digestible chunks because these plans, Medigap plans, are regulated by the government. So this is kind of a governmental type of chart. And so on the left-hand side, these just represent the gap. So remember, I mentioned look 2 rows down, Medicare Part B coinsurance. Well, remember, that's the 20%. You slide your eyes down a little bit more, the Part A deductible. Remember, that's that deductible that's a little under $1,700. So that's what you're getting the Medigap for, to help pay for that. Now, if you look at a lot of the letters, of course, the government's made it confusing and gave us a bunch more letters. If A and B wasn't confusing enough, and D, we have now G and N. But these are the standardized Medigap plans. And what I want you to notice is all the percentages. All those percentages represent is how much of the gap the plan will pay on your behalf. So I want you to look at the column G. That's one of the very popular Medigap options right now. And I just want you to look at every row, and you'll notice that almost all the rows have 100% under that G column. The only one that has a blank completely, if you slide your eyes over to the left, that's the Part B deductible. So remember, that deductible was $257. So essentially what a Plan G is designed to do is anything that falls under A and B, that 20% we talked about, the deductible, the per day costs, the G plan is going to pay all of that for the senior. The only thing it's not going to pay is that Part B deductible. Now, there's various iterations of, how much your responsibility would be under like the Plan N or any of these other letters. But for today's purposes, I just want you to get a feel for a Medigap plan with A and B. Your coverage can be almost 100%. And that's why I wanted to tell you it makes it quite unique. And it's really important to remember that a Medigap plan, there is no underwriting, no medical questions when you're going on to Part B for the first time. So whether you're turning 65 and going on to Part B then, or you've delayed it into the future because you worked a couple more years, when you go through that, when you enroll in Part B, you have an open enrollment window to choose any of the Medigap options. There's no medical underwriting. Your medical status makes no, they're not allowed to deny you for any reason. but you can be denied later on if you decide down the road you want a Medigap plan. You might be subject to medical underwriting at that point, and just be aware that you can be denied. So it's just something to remember. It's really important to know your choices when you're going on to Part B for the first time, just because of the rules do change as you get further and further away from the Part B. Now, notice that on the left-hand side, the Medigap plan really only follows A and B. So remember, Part D, prescriptions aren't covered under Medicare A and B, so you would want to add a standalone plan to kind of round out coverage. So let's talk next, though. So that I call that more of like a buy-up option because you pay an additional premium, but it's very, very flexible, very, very comprehensive. The other option that someone can choose is called a Medicare Advantage plan. So a Medicare Advantage plan is really kind of like the insurance that you've had through maybe your job. It's pretty much like that, where everything's bundled together. So it's a private company that has a regulated plan that's been approved by Medicare. It's also known as Part C. And essentially, it'll combine all of your coverages like Part A and Part B. It'll actually add the drug plan usually as part of the benefit. And then you'll also be likely that, well, you might have some additional coverages that Medicare doesn't cover, like dental, routine vision, glasses coverage, that you can get coverage as part of that plan as well. They all have out-of-pocket maxes to them as well, so you are protected there. And this is more of a pay-as-you-go option. So remember the Medigap I called a buy-up. You're paying an additional premium in addition to that 185 for Part B. A Medicare Advantage plan, many of them have little to no premium. So someone where, cost budget-wise, they're a little bit concerned about the stacking of the premiums on top of each other under Medigap, a Medicare Advantage Part C plan might be more to their liking just from a budget standpoint. And then also coverage wise, it's going to again be like your employer type plan. It is a network like a PPO or an HMO. And there's typically a lot of choices. And so, doctor networks, things like that, can come into play. But essentially, if you remember, one of the ugliest parts of original Medicare is the no out-of-pocket maximum. These two options will solve that issue and build in protection. So most everyone will usually choose one or the two options for that primary purpose of just mitigating that unlimited liability risk. So I'm not going to go into read this chart off, but I just kind of want to summarize a little bit of, what's right for you is going to be based upon cost and coverage. I do this every single day. And so I have people that would never, ever get a Medicare Advantage plan. I have other people that would never, ever get a Medigap plan. Here, the slide says Medicare Supplement. That's the same thing as a Medigap. So it just really depends upon how you want your Medicare to work. So coverage-wise, remember, Medigap, your coverage is almost 100%. And it's nationwide. You go anywhere Medicare is accepted. Cost-wise, there's additional costs for a Medigap plan. On a Medicare Advantage, that's more of the network-based plan. You're going to pay co-pays and co-insurance as you access care, just like an employer plan. They may charge a premium for the Advantage, may not. So budget-wise, the coverage can be to your liking that way. So it really just kind of depends on which one you want. But that's essentially the framework of how people address some of the uglier parts of original Medicare. Now, we've talked about the prescription drugs as Part D just a little bit, but I wanted to hit on it because Medicare or original Medicare does not do anything with prescription medications that you pick up at the pharmacy. And private insurance companies offer approved plans by the government for you to get your Part D. So there's actually two ways, and we've mentioned it already briefly, that you get a Part D drug plan. The first one is you get a standalone Part D drug plan that would accompany a Medigap option, or you can choose a Medicare Advantage Part C plan that bundles or embeds the Part D prescription plan inside of the plan itself, just kind of like what typical employer type regular insurance would do. So that's something that's really important to remember. That's how you get it. Now, one thing that's important to know about the Part D drug plans under Medicare is they're very different than what you might have had through an employer plan or private insurance, just meaning there's different phases of coverage that you go through when it comes to Medicare. And so, what plan is right for you really depends upon a number of factors. Every plan will have a different formulary, which drugs are actually covered by the plan, which are not. Many of the drugs that are covered will be under different tier levels. The higher the tier level, one, two, three, four, five, the more expensive the medication is. And so, based on whatever medication you have, you're likely to, depending upon the more expensive medication, you're likely to go through different phases of coverage. And so that's kind of what this bottom right chart shows is, under Medicare Part D plans, you have a deductible phase, an initial coverage phase, and then catastrophic. New for 2025 is they've put an out-of-pocket maximum of $2,000 of your share of the cost before you don't have to pay anything for your medications once you hit catastrophic coverage. Then all of your medications that are covered under the plan that are in the formulary, they'll be covered at 100%. So what all this means is a drug plan is very specific to your medications. Even someone in the same household as someone else that's on Medicare might have a different drug plan because their medications are different. And there's lots of different legislation phases that have been coming in. Like I mentioned, the 2000 out of pocket is new for 2025. Insulin medications are capped at $35 copays. And then drug negotiated pricing is actually coming on for 2026 and after. Now we have a new administration, so not sure, what if anything's going to change. This is based upon the Inflation Reduction Act that was passed in 2022. So a lot of this is written into the laws, but just remember that Part D drug plans are very particular for the person and the medications that they're taking. Okay, so when to enroll. So this is important just to note because this is when you're going to get all the stuff in the mail as you approach 65. You have a 7-month initial enrollment window as you approach 65. Now, there's other ways to get onto Medicare prior. That's like if you have a certain medical condition or if you've been on disability for at least 24 months. But for most people, it's going to be this time where you have a 7-month enrollment window. Most people will do it prior to their birthday month so that their Medicare begins on their birthday, the first of their birthday month. But I just want you to know it's a 7-month window. If you're already drawing Social Security, they're going to automatically enroll you in A and B. If not, you have to go to Social Security's website and enroll. And just note that this is an important window and you want to do it during this window unless you have that other qualified coverage. Usually that's again the employer-based insurance. Remember when after you've turned 65 and you continue to work, just be aware that there's some different enrollment windows for you. You have an 8-month window to enroll in original Medicare from when you lose your employer coverage. Now, again, most people are going to want to do this. We do this prior to that first month because we want a smooth transition. If you're losing your employer plan, you don't want to wait 2 months and then apply for Medicare. You want to do it so that you're transitioning at month 1. But that 8-month window's there. Just note that Part C and Part D enrollments actually have a different enrollment time period. So what does this mean? If you're coming up on losing your employer coverage or retiring, just contact us prior to when you're going to lose that coverage so that we make sure that you miss no dates and you're not going to miss one period that you thought was covered by something else. So it's just, you just don't want those gotcha moments. The other thing just to remember, just to understand is that every year there's what's called an annual election period. When you find that 9 out of 10 commercials instead of 1 out of 10 are Medicare, that usually means we're in the AEP time period, October 15th through December 7th. That's when someone can enroll in, change, or disenroll in their Part D prescription plan or a Medicare Advantage plan. So just be aware that there's changes that can happen each year, and that's when the enrollment season is. Now, if you're one of the unlucky fellows or people that did not enroll in Medicare Part B when they were supposed to and do not have other qualified coverage, there is what's called the general enrollment period. It happens only 3 months out of the year between January through the end of March. That's when you would want to enroll into Part B. Otherwise, you have to wait a whole nother year pretty much to hit that general enrollment. So we're in that time period now. So if you know anyone that has not done Medicare when they were supposed to, and I talked to someone literally last week that had called me for the first time, they went to do the enrollment now because we happen to be in that season. Okay, I think we're coming up on the little about the half-hour mark. So I know that was a lot of information, and so I want to save a little bit of time for some questions. But part of what I want you guys to know is you're not on an island when it comes to Medicare. This is what we do every single day. And so we offer lots of free resources that, go into a little bit more detail about what we've talked about today. But we do have a survival guide that we put out every single year. So we have our new one for 2025. You can definitely email us or download a copy of it from our website at goforoaks.com. You'll see that down at the bottom of this slide. And we also have a lot of other articles and links. We try to do a podcast occasionally, just a lot of different resources just to make sure that you feel you're supported. But then also just be aware that we're here. Don't feel like you have to become a Medicare expert to make decisions. And that's what we try to do is just partner with people, come alongside, provide as much education as you want. But also, as Paula mentioned at the beginning, we're independent. So part of what we do is we're able to work with all the different companies and just narrow things down so you don't feel overwhelmed with the 50, 60, 70 choices that you're getting in the mailbox. So here's our contact information. You can call, email. We're local to Austin, but we serve all of Texas, and we're probably in around 30 states now, just as we're very relational with our clients, which means most of those states were there because our clients have moved there, and we just wanted to continue to service their Medicare needs. Our services are always free to you. We're a broker, so all of our commissions and things are built into all of the different Medigap options in Medicare Advantage. And so our success is based upon our client success. As long as we provide a good service and continue to support you through the years, that's kind of how our compensation is structured. So we're always just trying to be a good advocate for our clients and stay abreast of all the many changes that are happening to Medicare, it seems like, from year to year. And we assume that that's going to continue to happen. So, well, that is everything for this Medicare 101 today. So what I'd like to do is, again, you can always let us know how we can help by contacting us here. But I will open it up to questions for anybody that might have a question that they want to ask based on some of the information that we talked about today. Just open it up. You can unmute yourself, and I'm happy to answer anything you got. Let's
We have a
see. I
question that
see
came
that.
through there. I'll read it. For those who choose a Medigap plan, what's the best way to get vision? I sh
Yeah, vision, probably dental and vision.
Yeah, dental vision most
Remember, dental and vision, right, are not covered under original Medicare, and the Medigap's not going to do it either. So the market has been addressing that. Obviously, depending upon where you are, the options can be different, but there's actually many of the insurance carriers have developed what are called DVH plans. That's an acronym for dental, vision, and hearing. Obviously, those are the three categories that original Medicare does not cover. And so what is right for you? I mean, that's going to be based on your particular circumstance. How much is your dental need? what types of things that you're needing. One of the things that does come up quite often that you want to remember is people that have been on an employer plan, a lot of times you're not used to waiting periods. A lot of the DVH plans in the individual market, because these are individual plans, can sometimes have waiting periods attached to them. So be aware of that. Always read the fine print. Some plans don't have waiting periods. So it's just a matter of, seeking out those. And obviously, if you have questions on that, we have lots of Medigap clients. So of course, we, address that as the need arises as well.
All right, we had another question come in. What about retired teachers? Does their teacher retirement system coverage end at 65 or does it continue as a qualified coverage?
Yeah, that's a great question. So I don't want to get too far over my boots here. I always basically tell teachers, specific coverages for them under the TRS system. It's kind of a joint effort. I don't work for TRS, so I'm always saying, make sure that you're having a conversation with them as well. But I will tell you that TRS has its own group Medicare Advantage plans that most teachers qualify for based on being on the retiree program. And so normally they're going to want the retiree to go onto original Medicare, and then they will automatically usually enroll that retired teacher into the group Medicare Advantage plan. And so I talk to retired teachers a lot. And so, it really is going to come down to that, what I mentioned earlier, cost and coverage. Medicare Advantage plans, some people think they're great. Some people don't want them at all just because of how Advantage plans are more under the umbrella of the insurance company, as opposed to, remember, Medigap doesn't do that. It just everything flows through original Medicare. So there's a bit more flexibility there in how coverages can work when you don't have an insurance company making decisions. So typically, you will automatically be enrolled in that Advantage plan unless you actively disenroll. So a lot of retired teachers, I'll say, my job is not to convince you that TRS is bad. I don't think it's bad. I think it's really just to understand your options so that it's more of an active enrollment into TRS as opposed to a passive, oh, I'm just going to go in there and not know what my other choices are. I have many teachers that have decided to go the Medigap route because it is different than the Advantage. I've had other people go the TRS route. I've had other people go Medicare Advantage without TRS just due to premiums differences and things like that. So it's an individual conversation, retired teacher by retired teacher.
Right. And also, we've definitely run into that with teacher spouses as well. Some people think, they have to put their spouse on that, and that's not necessarily the case.
Yeah, I mean that's a very good point, Paula. Again, that's why it's very important to always have a conversation with TRS, because there's going to be some very specific circumstances. Some teachers do not pay into Social Security. Well, they usually need to go the TRS route because they can't access Part A at premium free. Another reason to stay on TRS is, right, maybe a retired teacher has dependents that aren't quite 65 yet. A lot of times, my understanding is they need to stay on the TRS plan to keep those dependents on the non-Medicare Advantage TRS option. So sometimes you need to stay within the TRS bubble to have continuous coverage for maybe someone that's not quite Medicare eligible, like a spouse. And then obviously, dependent coverage can be more expensive. So sometimes a retired teacher gets a better rate than a Medicare eligible spouse that's more expensive. So again, it just depends upon the circumstance with what their situation is. But very good question, and it's always a good to flesh those things out so that they can make a good decision.
Dawn, did you have a question? I saw you unmuted. Oh, you remuted.
Oh, I do see a question. So can you read that one,
Yeah,
Paula?
sure. Is Plan F still available to those enrolling Part A and B in 2025, or has it mostly been replaced by the Plan G, referring to Medigap plans?
Right. So that Plan F has been phased out for those that became Medicare eligible on or after January 1 of 2020. So basically, no one generally is going on to Plan F anymore unless you became Medicare eligible prior to that, then you're grandfathered in. You don't lose the Plan F, you're grandfathered in to have the choice to choose Plan F if you want it.
Great. I have another one here. So can you switch from Medigap to Advantage and back year to year? That's a great question.
That is a great question. So, geographic, we can have some different answers based upon where you are geographically, but since most of us, I believe, are in Texas, I'll going to give the answer based on that. Essentially, you can always go from Medigap to Advantage. Medicare Advantage plans they don't have health questions. And so you can go from Medigap to Advantage during the annual election period for a January 1 start date. And you can also go from Advantage to Advantage. Now, Medicare Advantage plans going back to Medigap plans, you cannot always do that without sometimes having to answer those medical underwriting questions. So unless you have a very specific circumstance where you have a guaranteed issue right to get that Medigap plan, if you're out of that Medicare open enrollment window, remember that's a 6-month window after having gone on Part B. Once that window closes, unless you have a very special circumstance, you can go to Medigap as long as you can be medically underwritten and approved. So be aware of that, is once the medical questions are there, they can say no, and your ability to go from Medicare Advantage to Medigap can be limited or denied completely based on your health at that point. Those are very good questions. You guys were listening. So that's
Yeah.
awesome.
Oh, I think
7:45 in the evening.
that one's really important because I think a lot of people think, oh, it's $0. I'll go on the Advantage plan because they're healthy and they don't need it. And so it just, seems like a better deal. But then later when they are maybe a little sicker and, would like, a more buy-up plan option, it may not be available. And so I think it's always good to to know that going into that really big decision.
Absolutely. I mean, we go through all of that every time we have any consultations and stuff. It's just really important to remember that is you want to make the right choice in the beginning and based on the rules as they're laid out, so
All
that
right.
you know
We
how
have
things
another,
change.
yeah, we have another question here. If you go on to Medicare Advantage prior to 65 due to SSDI, do you get another protected window at age 65 where no medical questionnaire is required and could get a Medigap plan potentially?
Yeah, that's a great question. And that helps me flesh out something else that I'd mentioned. You know, we this was webinar was really designed as people are approaching 65, but obviously people can go on to Medicare prior to 65 if they've been on Social Security disability. And so one of the things is to answer your question specifically is yes, you get a new open enrollment window, and to pick a Part B, to pick a Medigap plan. And the reason that's important is that chart that I showed of all the options. Remember, I mentioned the G and the N. Not all of those are available to somebody that is on Social Security disability and under 65. The Plan G, like the Plan N, the most popular ones that are available in the market, I'm really talking about those that are 65 and older. Your choices are very, very limited and not as good. And many people, you only have one choice, the Plan A, to go on with a Medigap option. And it can be quite expensive as well, much more expensive than what you could get when you turn 65. So just be aware that, many people that are on SSDI on Medicare, many of them will go on to Advantage plans because of affordability reasons. Then once they turn 65, then we have the option to pick those Medigap options that are much more reasonably priced and much more comprehensive as well.
It's great.
These are great questions.
They are. All right. Does anybody have
Any other questions for today? Well, great. Well,
Awesome.
we're thrilled that you guys were a part. Just keep our information handy. And as you have questions that pop up, just remember we're a free resource here and happy to answer general questions or answer more specific questions as you start approaching decisions on what to do with Medicare in the future.
Yeah, and any advisors on here, if there's other resources you can think of that's helpful for your clients, obviously we're happy to do that. Happy to do these kind of webinars for clients or groups of clients. So just definitely reach out to me and let me know if that is helpful.
Right? Well, without further ado, we'll call that a wrap, and you
Yeah.
guys have a great evening.
Yeah. Thanks so much for your evening. And hopefully we'll have some more of these more evening related ones because definitely seem to be needed. So anyway, thanks so much, everybody, and we'll see you soon.
Okay. Bye bye.